Stephanie Belflint joins us now to talk about cancer clinical trials. If you have questions, you can send them to the doctors at WLBT.com.
Thank you, Maggie. This is probably one of the first things that comes up when somebody gets a diagnosis is there's something, a magic bullet out there, and you think in a clinical trial maybe there is. Joining us now is Teresa Davis with Jackson Oncology Associates, and she's over some clinical trials here at Baptist, and people probably don't know that we have clinical trials here in the Jackson area.
That's right. We have several community-based clinical trials here available for our patients where they don't have to go out of state to a larger cancer center. We try to focus on trials that are most commonly seen with certain cancers such as colon, breast, prostate, and lung cancer.
How do you find out if you are eligible for a cancer trial? If you are a patient, you're saying, look, I want to find out what I can do to treat myself. How do you know if you're eligible?
Okay. Of course, websites have a lot of different information. For each trial, each patient has to be eligible exactly for that trial, meaning their disease has to be the appropriate stage, lab work normals have to be evaluated. So all those things are taken into consideration. And one thing that we do is evaluate patients for clinical trials and help them find the trial that suits them best.
And when you're talking about clinical trials, are you talking about possibly new medications that may be on the horizon?
Right. Trials are done to find new uses for older medications, but they're also looking at newer medications. Sometimes that may be the only available treatment for a patient is through the form of a clinical trial.
So somebody doesn't automatically, though, when they're first diagnosed with a cancer or whatever type, wouldn't automatically go into a clinical trial, would they?
They can. It does not have to be a last resort, so to speak. Trials are available for all stages of cancer and for all phases of the disease.
Now, in addition to the treatment, what else does the patient get out of it? Do you get free medical care, medicine? What exactly happens?
Each trial is different depending on the sponsor of that trial, but for one thing, patients take a more active role in their health care because they do have to follow the protocol, so to speak. Sometimes other lab tests or x-rays are required, so that does mean a few more trips to the clinic, but sometimes you do receive your medications free, and then you're followed very closely by a nurse and your physician to evaluate any side effects that you may be experiencing.
So somebody may be asking, what can I get out of this? What would you tell them?
Taking that active role in your health care, also helping people down the road, because these trials and this data is collected for the future as well, not only the present.
Teresa, what are some of the more exciting and promising trials that we have going on right now, just to kind of give people an idea of the area that you're venturing into?
There is a new drug being approved this year that we actually participated with the trial for metastatic prostate cancer. There's also a new breast cancer drug coming, as we're part of that trial as well, that targets triple-negative breast cancer, which is a very small population of breast cancer ladies, but it can also be in a very aggressive form of the disease.
And what does it do for that triple-negative? Because that's a cancer that basically doesn't go away.
Right. It targets specifically that patient who doesn't have the ER positive or the HER2 positive disease that the other drugs can target. This is a drug very unique to itself because it works specifically on the triple negative population.
Now, I know that there are some people who have reservations because they say, I'm a guinea pig.
Right.
And they have that stigma is there. How do you deal with that?
A lot of patient education. I think it's real important that they're comfortable in what they're doing. They have to be comfortable with their physician and also with the nurse that's guiding them through that trial. I always remind patients that these trials are very carefully monitored by the drug sponsor and also by the FDA. Everything is reported directly to that sponsor and the FDA, so these side effects are followed very carefully and managed appropriately.
Now, you're going to be having a seminar here pretty soon. Talk about that.
Yes, next Tuesday at noon, which is the 13th, at the Hetterman Cancer Center, the ground level there in the conference room. I'm going to do an informal 1-hour lunch and learn about and answer questions about clinical trials and what patients need to know before they're entering one.
And who would come to that? People with family members with cancer, people who have cancer? I mean,
anybody who wants further information. Family members are fine, or patients themselves.
So again, even if you're healthy and you want to know, because you never know when it's you or a family member, this is a great way to have the information, be educated ahead of time.
Right, and know what options are available for people.
All right, we appreciate it. Teresa Davis with Jackson Oncology Associates, and good luck with the seminar. People want to go to the seminar, they just contact Baptist Medical Center?
Yes, or they can call the helpline at 601-948 888-888-6262.
All right, Teresa, thank you so much, and thank you for what you do. It's very important.
Thank you.
And for more health news, you can log on to our website, WLBT.com, and click on Medical Matters.